Hello, I'm Dr. Ross Walker and welcome to the checkup.
Hello, Dr. Ross Walker and welcome to the checkup. I'd like to talk to you today about the most important cardiovascular risk factor, and that's high blood pressure. Now, the problem with high blood pressure is that 50% of people with high blood pressure don't even know they've got it. And of the 50% of people who know they've got high blood pressure, half aren't on enough treatment. So one of the problems here is what we call adherence, otherwise known as compliance. Compliance is when you're told what to do and you do it, whereas adherence is when you have a partnership with your doctor and you adhere to the advice you've given. Now, the problem with adherence is when you're given 2, 3, 4, 5 pills, if I line up 100 people and give them the same therapy, even if it's one pill, after 12 months, 50% have stopped because Homo sapiens as a species are a sorry lot. They don't do what they're told or what they're advised to do. So the people at the George Institute in Sydney did this wonderful study, supervised this study of 571 people who had high blood pressure. And they treated half with what we call a quad pill and the other half with just standard blood pressure therapy, which is building up the treatment to achieve a result with your blood pressure. And this was a 12-week study. And what's a quad pill? A quad pill has 4 low doses of blood pressure pills in the one pill. And so the standard groups of blood pressure is what we call calcium channel blockers, angiotensin receptor blockers, beta blockers, and a bit of diuretic. So 4 of these low dose pills in one pill. And the good thing about having 4 low doses is you have much less side effects by combining lower doses rather than the big dose of one. So the stronger the dose of anything, the more side effects you have. So anyhow, what they found was after 12 weeks, the people who were on the quad pill, as opposed to the people who had standard therapy, 80% achieved control of their blood pressure, whereas only 60% achieved control with standard therapy, which is basically what we see in medicine, that really only 50 to 60% of the people we treat achieve the control we want them to achieve. So I think over the next few years, we're going to see this quad pill becoming standard therapy for high blood pressure. And I, for one, will be certainly using this in my patients. That's the checkup. We'll talk to you next week.